Hi, I'm Frank Quinlan, the CEO of Mental Health Australia. I think we've had quite a week in mental health this week, probably not the week that many of us were expecting, with the release of the National Mental Health Commission's review of programs and services. While we're still analysing that report, which was only fully released yesterday, we just thought it was worthwhile releasing a bit of a quick summary so that people can get their heads around exactly what's in the report and where they might perhaps find some of the information that you might be interested in. The first thing I'd say is that the leaking of the report and the context of the discussion of the report in the lead up to COAG, I think has been really problematic. We were certainly hoping that the government would release the report much sooner than they did. We've been suggesting since they received the report in November that it'd be good to get the report out and to get people talking about it and consulting about it. But I think the unfortunate timing of the leak just before COAG really meant that the government was forced into positions of backing away from some of the recommendations sooner than perhaps might have otherwise happened. I think that was a bit unfortunate. But nonetheless, we're pleased now that the report's out, and we hope that there can be now a bit of an ordered conversation with various stakeholders, Mental Health Australia and its members, consumers and carers, and others, so that we can actually now take this strong platform that the Commission have provided us and turn it into real action for change. I think the first observation that I'd want to make is that this is really quite a comprehensive report. It's constrained by its terms of reference in that it's looking at Commonwealth programs principally, though it does try to gather some information and make some commentary on state programs. It's principally a report that was commissioned by the Commonwealth Government and for the Commonwealth Government. So I thought, again, forgive me looking at my notes, but we're all catching up with this as we go along. I thought I'd just sort of talk through the main structure of the report and make some reflections as we go. So the report's available in 4 main volumes. There's also some supporting documentation. I've seen a summary, I've seen an infographic, I've seen some fact sheets that are produced as part of the report. But the main volumes of the report itself are the strategic directions document, which outlines the process and ideas for the next 1 to 2 years. A document called Every Service is a Gateway, which describes the specific response to the terms of reference that the Commission faced. What people told us. So there's quite a substantial volume that looks at all of the input that the Commission received in its various submissions and various discussion processes, and feeds that back in quite a sort of discussive, qualitative way. And also then a set of supporting papers that collate some of the evidence and provide some of the background research that the Commission undertook during the 12-month review process. The main findings of the report are in 25 recommendations across what they describe as 9 structural or strategic directions, and they're available as part of that summary document, which we can point you to at the end. The review identifies, and I'm reading now some direct quotes from the review, which I think will give you a strong sense of the picture of the report. The review identifies fundamental structural shortcomings across poorly planned and badly integrated systems, with submissions conveying a hit and miss arrangement of services and programs around the country, seemingly based on no discernible strategy, creating duplication in some areas and considerable unmet need in other areas. The overall impact it describes as a massive drain on people's well-being and participation in the community. And as we know, sadly, this is consistent with the findings of so many other reviews of mental health and mental illness. I think one of the thoughts that I've had as I've been reading through the report is that I hope that this is not disheartening for so many of the workers who are at the front line of this effort. There's so much commentary about the sort of failure of the system, and so much commentary about how disorganised the system might be, that I hope that's not something that's disappointing to those of you who are working at the coalface. To be fair to the Commission's report, It certainly doesn't make findings about poor quality work. It doesn't make findings about a poor quality workforce. It really does focus on the system and the problems with the system. And I don't think there are many workers in the system who wouldn't agree with those findings. The terms of reference, as I said, were constrained from the outset because the Commission was required to look at the efficacy and cost effectiveness of programs, services and treatments, which is broad, to look specifically at duplication in current arrangements, and funding priorities for mental health and for gaps in services and programs in the context, and I think this is particularly important, in the context of fiscal circumstances facing governments. So really, I think that's code for saying the Commission were constrained from the outset by saying they really had to look at the cost of mental health services and programs within the current funding envelope. And I think that explains some of the recommendations that we see later on. In response to those terms of reference, the Commission found no real evidence that specific Commonwealth-funded services and programs were not adding value or that they should be defunded due to lack of impact. So I think there's some encouragement in that finding, because what they're saying is there's not room to defund. There's not too much money in the system. There are not programs that it identified that are clearly failures or clearly not working. And I think that's an important part of the findings. But they also found that the Commission's ability to make judgments about the evidence for these programs was severely constrained by limited information available at state and territory level, and by limited information evaluating some of those programs. And obviously that's pretty problematic, and explains some of the recommendations that the review makes later on about gathering precisely that evidence that will be required to justify programs. But overall, I think what they're largely saying is that the funding envelope can't be adjusted too much, it certainly can't be adjusted down, and that particular programs aren't identified for or singled out as failures. Reflecting on the current fiscal situation, the review finds, and I quote again, "The strongest expenditure growth is in programs that can be indicators of system failure, rather than in areas that prevent illness and will reap the biggest returns to the economy." And I think, again, this reports something that we all know. It is really identifying the fact that our system is based largely on the acute and on the expensive end. That's where the money is, at least. It does identify in many areas that we don't do a good job even of that work. But it really reinforces that need to move our investment earlier so that we can prevent some of that illness, so that we can reap the benefits of investment rather than just meeting the crisis need. And it points to some work commissioned by KPMG as part of the study that follows a bit of an economic analysis of what some of those scenarios might look like. There's a link in our online summary, the summary that appears in my update this week. There's a link to some of all of this information, actually. As one of the central headline findings that I think people will be interested in is that primary health networks should be renamed and should be called primary and mental health networks, and that these should be key regional architecture for planning and purchasing of mental health programs. So that's really quite a substantial direction and quite a substantial change from where we are now. We know that many programs have previously been purchased and sometimes delivered through Medicare locals under previous arrangements. This report is clearly asking government to focus on primary health networks as a major avenue for identifying need and for rolling out services and programs quickly. The transition from Medicare locals to primary health networks is still underway, and of course those winning tenderers for primary health networks have only just been announced, so there'll clearly be quite a transitional period of getting that underway. Another one of the headline reviews that appeared a lot in the press, and as I said in my introduction, was discussed a lot in the lead up to COAG, was the idea that $1 billion should be shifted out of hospitals and out of the acute end and over time transitioned into stronger programs in the community. $1 billion sounds like a lot of money. It is a lot of money, but I think it's also worth noting here that it is also a tiny, tiny fraction of the expenditure that the Commonwealth makes on hospitals. And from the table that the Commission provides, scaling in this change over a number of years, they really were anticipating that the full transfer of that money wouldn't occur until 2022. So that's a bit of a way down the track. And what the report anticipated was that the expenditure that we made in early intervention and prevention would actually have the impact of reducing the demand for those acute services. As I said, the Minister in the lead up to COAG has ruled out that expenditure or that shift of expenditure directly, but I'd hope that in the agreements that we can come to with the states and territories, we can find a way of achieving that sort of transition and that sort of change of focus, because that's another area that's been repeated time and time again in various findings of various reviews. We need to get services into the community, we need to get them closer to where people are, and we need to focus on early intervention and prevention. So hopefully that's one of the areas that will be negotiated. We're currently doing a much more detailed analysis than the one I've just provided to you now, and in particular we're comparing the findings of the Mental Health Commission's report against the directions that we'd outlined in the blueprint. It's already quite evident to us, although I do note that the Commission's review doesn't mention the blueprint that we developed over the course of the last 12 months or so. The report does point to many similar directions and many of the areas that we had identified. It talks about the lack of consistent outcome measures nationally. It talks about the lack of indicators and targets, another area that we were very vigorous in our advocacy on. It talks about the need for clarity in the roles and responsibilities of the Commonwealth and states. So it's immediately apparent that there are lots of areas of agreement between the work that we did along with you over the course of the last 12 months and many of the recommendations that the Commission has made. It looks on the face of it like there might be some gaps or discrepancies at least. The first that comes to mind is there seems to be no reference in the Commission's report or findings to specific structures or processes to ensure consumer and carer participation in the governance of new arrangements and to ensure that consumers and carers are appropriately represented and that leadership is appropriately developed and so on. So again, that's an area we'll look into more. Overall, I think I'd want to say, just in concluding this very initial summary before we get to the details, that the Commission is certainly to be commended for their report. They've painted a pretty stark picture of the circumstances in mental health, sadly circumstances that many of us have known about for a long time. It's very important, I think, for us to give these processes the legitimacy and the backing that they need to bring about change. The real concern is that this could end up being a report that sits on the shelf like so many other reports that have gone before it. And it'll do that, I think, if a couple of things happen. One of the ways that this report could be undermined is if what we now see is a sort of breakout of confusion and infighting and different agendas across the mental health sector. I think wherever we see that that disunity break out, it can give governments an easy path not to take action. And I think the sort of unity that we achieved as we developed the blueprint over the course of the last year is the sort of unity that we should be looking to encourage and continue into the year ahead. And the other area that I think where these things can fail is if they're not appropriately owned and managed and governed really by government, taken on board and actually prosecuted. And that's why in our response yesterday, our initial response to Minister Lee's announcements around the release of the formal and final copy of the review, we actually supported the idea that this work needed to be taken to COAG. We know that work has been to COAG before. We know that COAG has failed to deliver too many times before. But we also know that without governments actually cracking this nut and resolving some of the challenges that seem to be perennial, that this reform simply won't be achieved. We said in our blueprint that we wanted there to be a new national agreement on mental health. We note that the Commission makes that recommendation also, and we're very supportive of that recommendation. I think that's really the starting place for so much of what else flows out of the report. But there are many things it's apparent too that the Commonwealth Government can and hopefully will get on and do. The Mental Health Commission have made some very practical suggestions, and I don't think we need to let the establishment of new governance arrangements get in the way. That's a bit longer than my usual updates, but again, given the importance of this issue, we just thought it was important to get something out there. As I said, if you subscribe to my weekly update, or if you look at it online at MH Australia's, Mental Health Australia's website, you'll get all the information and links to some of those documents that I've talked about. We'll be providing you with more information, a more substantial update over the course of the next week. I'd commend the report to you, read it, and I'd also ask you to consider the role that you might play in ensuring that this reform is achieved this time. Because as I said earlier, we don't want this to be just another report that sits on the shelf. Thanks for your time.